Well, the American Cancer Society knows that a ride shouldn't keep patients from getting life-saving treatment. And here at the station, our KUTV and our parent company, Sinclair, are teaming up with Road to Recovery, the program for that mission. Susan Gartell is here with the American Cancer Society in Utah to show how many ways we can help. So Road to Recovery specifically is one of many services that the American Cancer Society provides.
Yes.
And what is it?
Yeah, so Road to Recovery is American Cancer Society's program to make sure that no one can't go to treatment because they don't have a ride. We know that access to treatment, transportation specifically, is the #1 barrier that keeps people from going to appointments. And of course, you can't survive cancer if you can't get to your treatment. So ACS teams up with volunteers to make sure that people can get free rides to and from their cancer appointments.
Who qualifies for something like this?
To get treatment, or to get the rides?
To get the rides.
To get the rides, really anyone who's going through cancer treatment is able to sign up. So you can come to our website. It's actually cancer.org/transportation. That's where you would go if you are in need of getting transportation, if you're having trouble getting to treatment. Yeah, and it's anyone who is at any point in their cancer journey, really.
Okay, and you just go to the website and find what kind of transportation and how far do you serve?
Yeah, so like we have different markets, like we're in all 50 states right now, which we're really excited about. But I will say, like, we have here in Utah, we have 38 drivers currently, but that's only a 70% fulfillment rate. So that means that 30% of our ride requests are going unfulfilled.
Oh, no.
Yeah, so we're hoping that about 15 more volunteers would be able to fill that gap and make sure we can get to 100%.
Okay, now I know you have the Hope Lodge.
Yes.
And I know some drivers take the patients from Hope Lodge right up the hill for treatment at Huntsman or the U or wherever they need to be.
Or LDS Hospital.
Or LDS, wherever they need to be. And do those volunteers wait for them for their treatment? How does that work?
Yeah, so it totally depends, right? Some treatments can be, a matter of like 20, 30 minutes, and then the driver would wait. There are other treatments that take all day long, and so you can sit at a coffee shop, read a book, do whatever you need to do, go pick up your own kids, and then come back. So the nice thing about this is that you're able, it's kind of like Uber in the sense that like the driver can see the ride request and decide, is this a good time? Do I have time to take this ride? So you are always in the driver's seat, as you'll say. So yeah, you can decide whether you can take the ride or not.
Okay, who can volunteer to drive?
So you have to be 18, you have to have a car and a driver's license. Those are kind of no-brainers, and insurance. Training is only 1 hour, really, so it's a really easy commitment. And then you have to go through a vehicle inspection. But other than that, anyone can be a driver.
It's just to be safe and kind.
Yes, exactly.
You have to pass a test.
Yes, yeah. Yeah.
And the qualification, I mean, just for one class like that, why do you need so many drivers?
Because the need is so great. Honestly, I think that's it. Is like I said, with 38 drivers, we're not meeting that need. So, now more than ever, we just want to make sure that people have access. Like, what a terrible thing. Again, this is the #1 barrier to people getting treatment, is they just can't. A lot of times people can't drive themselves, whether that's they're not feeling well, but they don't have access to a car, public transportation, especially in Utah. People are coming from rural communities. So we just want to make sure that this is not something that is another burden for people who already have the burden of a cancer diagnosis, that they can't get to their treatment.
Well, I know going through it, 13, 14 years ago, I was always so thankful that my husband was there.
Yeah.
But not everybody's that lucky.
No.
Not everybody has someone who can help them every day or once a week or whatever, and they really need somebody to help them out, or they can't get the treatment.
They can't go. Yeah, and then I will say, I think people talk about the relationships that they build. These are you're there, kind of meeting a need at someone at a very vulnerable point. And there's so much kindness, and there's so much, I think people get really close to the people who are driving them and to the patients that they're serving as well.
You become friends.
Yeah,
and you look forward to taking them to their appointment next week or tomorrow.
Yes.
Become friends.
And you get to feel like you're a part of that journey. You're doing, that you really are key to helping heal someone.
Yeah, and maybe curing their cancer.
Exactly.
Okay, now Road to Recovery is just one of many things that the American Cancer Society does. And I know when you first are diagnosed, you get this stack of papers, and it's so overwhelming, but how do you find out about all the services that you have? I mean, who knows? You can get a ride.
Right, yeah. And one of many things. So, I mean, if you just go to cancer.org, that is the American Cancer Society's website, and that has just a wealth of information. So we are the most trusted source of cancer information for anywhere in the world. And so whether it's you're looking for a place to stay, which is our Hope Lodge, whether you're just looking for, someone to talk to, a lot of people don't share their diagnosis. And again, like the stress response, a lot of times you're not listening or you can't actually take in the information. There's so much information. So whether that's about nutrition, about rides, about support, about wigs, about, the whole scaffolding of that cancer journey, right. ACS is here.
Well, and it's funny because even if you don't provide that service,
right.
you can recommend somebody who does.
Absolutely.
Okay.
Yeah.
And almost all of it is free.
Yes.
To the patients.
Yeah.
And there's no sliding scale, no qualifications. Insurance covers everything, or just.
Yeah, everything that ACS provides is free. Obviously, we're not your healthcare provider, so we're kind of the scaffolding that and the convener. So we want to work in concert with everyone else that we have, and we're lucky here in the Wasatch Front. We have such really great cancer resources and medical services here.
Right.
But so yeah, we're here to make sure that everyone has the information they need and the services that either we're providing or that we can put them in touch with the right person.
Yeah, and some people don't even know about Hope Lodge.
Right.
We've been doing stories for years on Hope Lodge. I know one couple, a teacher from Monticello, was driving all the way up for 3 days of treatment, and she and her husband got to stay there while she got her treatment, and then they drive all the way back. And some people don't know the service is there. It's this beautiful lodge hotel that takes care of people.
Yeah, honestly, I live like a mile away, and I had no idea it existed until I started working for ACS. I mean, and part of that is anonymity because we want it to be a home away from home.
And it's beautiful.
But it's this beautiful lodge, and we're actually about to celebrate 10 years of being in Salt Lake City. We're one of only 32 across the country, so we're very, very lucky to have one here. And we're the second busiest in the country, so we are constantly full.
Because we have such great medical help.
Exactly, yes.
Okay.
Yeah.
Fantastic. And it's so easy, cancer.org. If you have any questions, I love that you said nutrition, help for so many ways to help people through the process and get better.